Welcome to our deep dive into OTEZLA. This guide is like a backstage pass to understanding everything about this medication, from its uses to its potential side effects. Whether you're a patient curious about your treatment or a healthcare pro looking to brush up on your knowledge, we've got you covered. Number 1. What is OTEZLA? Think of it as your friendly helper in fight against certain pesky skin conditions like psoriasis, psoriatic arthritis, and even Behçet's disease. OTEZLA is like that superhero in your body, swooping in to calm down the inflammation caused by your overactive immune system. But here's the kicker. It's not your typical anti-inflammatory drug, even though it does reduce inflammation. Nope, OTEZLA is more like the cooler and better version of an immunosuppressant. It helps lower the activity of your immune system to keep things in check. And trust me, it works wonders for many folks dealing with these conditions. Number 2. What are the common side effects? Now let's talk about the not-so-glamorous side of OTEZLA, the side effects. Yeah, unfortunately, it's not all sunshine and rainbows. Some folks might experience things like diarrhea, nausea, and even a bit of vomiting, especially in those first couple of weeks of starting the medication. But hey, it's usually not a showstopper. Most of the time, these side effects mellow out as your body gets used to the medication. And if things get a bit too rocky, your doctor can always tweak your dosage or explore other options. So while the road might be a bit bumpy at first, many people find that the benefits of OTEZLA outweigh those temporary hurdles. Number 3. Who can benefit from OTEZLA? Now let's get into the nitty-gritty of why OTEZLA exists in the first place. This medication isn't just some random pill thrown into the mix. It's got a purpose, my friend. OTEZLA is FDA approved to tackle 3 main conditions: plaque psoriasis, active psoriatic arthritis, and mouth ulcers caused by Behçet's disease. So if you're dealing with any of these, OTEZLA might just be your new best friend. It's like having a specialized tool in your toolbox for those specific issues that other medications might not fully address. Number 4. How should OTEZLA be taken? Taking OTEZLA correctly is essential for its effectiveness and safety. Typically, OTEZLA is taken orally twice daily, once in the morning and once in the evening. Your doctor may adjust the dosage based on your individual needs and medical condition. It's crucial to follow your doctor's instructions carefully and not to crush, split, or chew the tablets. Additionally, if you miss a dose, take it as soon as you remember, but do not double up on doses. Number 5. About off-label uses. Okay, so here's where things get interesting. While OTEZLA has its official stamp of approval for those 3 conditions we just talked about, some doctors get a bit creative and use it off-label for other stuff too. Now before you start picturing doctors as mad scientists experimenting with pills, let me clarify. Off-label use is actually pretty common and totally legal. It just means that doctors are prescribing OTEZLA for conditions other than the ones it's officially approved for. So while it's not an FDA-approved treatment for things like eczema or rheumatoid arthritis, some people have found relief using OTEZLA for these issues. But of course, always consult with your doctor before venturing off the beaten path. Number 6. How does it interact with other medications? Alright, let's talk about mixing cocktails. Not the fun kind, unfortunately. OTEZLA can be a bit finicky when it comes to mingling with other medications and supplements. Certain drugs like carbamazepine or St. John's wort can make OTEZLA less effective or mess with its metabolism. And trust me, you don't want to mess with that delicate balance. So before you start popping pills like candy, have a chat with your doctor or pharmacist. It's all about playing it safe in the medication dance. Number 7. Does OTEZLA cause weight loss? Now, one interesting tidbit about OTEZLA is its link to weight loss. It turns out many folks who take OTEZLA shed some pounds along the way. But why? Well, it's a bit of a double whammy. You see, OTEZLA works its magic by blocking an enzyme called phosphodiesterase 4 or PDE4. This enzyme doesn't just play a role in inflammation. It's also involved in energy metabolism. In animal studies, blocking PDE4 made them leaner, with smaller fat cells. And guess what? The same might hold true for us humans. But that's not all. Some people on OTEZLA might find themselves with a reduced appetite or even experience diarrhea as a side effect. As you can imagine, these effects might also contribute to the weight loss journey. So if you're noticing a change in your weight while on OTEZLA, don't fret. It might just be the medication doing its thing. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 4. Are herbs and supplements effective for treating psoriasis and psoriatic arthritis? For individuals grappling with the challenges of psoriasis and psoriatic arthritis, exploring alternative treatments like herbs and supplements is common. Aloe cream, celebrated for its skin-soothing properties, is often sought after to alleviate discomfort and minimize the redness associated with these conditions. Fish oil, abundant in omega-3 fatty acids, is another contender, with some evidence suggesting its potential to mitigate inflammation, which is a hallmark feature of both psoriasis and psoriatic arthritis. Additionally, saffron and St. John's wort ointment have garnered attention within the community seeking natural remedies. However, it's essential to approach these options with caution, as their efficacy hasn't been definitively established through rigorous scientific research. Number 9. Is OTEZLA safe during pregnancy and breastfeeding? Similar to its impact during pregnancy, OTEZLA's effects during breastfeeding remain uncertain. Although studies have shown OTEZLA to be present in the breast milk of lactating animals, the implications for humans are still uncertain. As a result, your doctor will likely advise against breastfeeding while taking OTEZLA to err on the side of caution. It's essential to have this conversation with your healthcare provider to make an informed decision about your treatment plan. Number 10. How does OTEZLA compare to biologics? OTEZLA offers a unique approach to treating psoriasis, psoriatic arthritis, and Behçet's disease compared to biologic therapies. While OTEZLA is not a biologic, it is an immunosuppressant that works by lowering the activity of the immune system. Your doctor will consider various factors including your medical history, risk for side effects, and the severity of your condition when determining the most suitable treatment option for you. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!